Now, NutraMetrix. For those of you who are new, what is NutraMetrix? Well, NutraMetrix is a division of Market America that is dedicated exclusively to health professionals, exclusive labeling and services and support to help implement revenue-generating wellness programs for health professionals. You must be trained as a NutraMetrix consultant to implement programs in practice, and everybody in this room benefits from NutraMetrix. We have some very, very exciting announcements that will impact everybody in this room, and I cannot tell you how excited I am about today. Now, as far as our audience, who do we have here? We have lots of health professionals in this room who are committed to the wellness vision and making a difference. We have our NutraMetrix consultants who have been trained and are committed to delivering the wellness solutions for our health professionals. And we have all of the rest of you, which are Market America distributors. Every single one of you has the ability to leverage the power of NutraMetrix in your own business, and I am going to show you how today. Now, as far as health professionals and the market, let's have a really quick understanding of what's going on in the healthcare community. The fact is, the medical economy is changing. Healthcare is changing. It is not what it used to be. Cost of business going up, shrinking insurance reimbursements going down. It's all over the news. What this boils down to is the fact that profitability in healthcare is going down, and it is time for change. Healthcare practitioners must make change to be able to survive. Every business must generate revenue to be successful, and they are no different. Patients are asking for answers, and if we simply listen to what the patients are asking for, we are able to answer them with customized solutions to match the needs of each practice and each patient. People are asking for help losing weight. They ask, which multi do you recommend, which D3? The blood levels are showing low D3 levels or other markers. They ask, what do you recommend? And what options do I have? What alternatives do I have? We provide these answers so that the health professionals can give them to those patients. Using our phenomenal products, which you just learned some about, we have our isotonic solutions, which absolutely work. Because they deliver the results that they do, they work, and we have success. We have our customizable nutrition, able to custom design formulas for each patient or for each practice, building retention and revenue like never before with something nobody else has, which is customization. We have, of course, our TLS weight loss solution. We are the most overweight country in the world. Do you think we need a solution? And do you think TLS works? Okay, how many, just noise from everybody who's lost weight with TLS. I think we have a solution that works. Being able to provide that in medical, look how many lives we can change. Now, one step further with customization is our GeneSNP DNA analysis. We're very excited to let you know that it's entering into beta testing. Phenomenal new program that Marty Weissman and team have worked very hard on to bring you something innovative and new. More announcements will be coming out on that in the future. We also have, of course, our marketing systems to help our practices succeed, and we have a brand new poster that we're releasing this weekend. It's actually available right now for download. Thanks to Elizabeth Benton and James Jordan, our creative design staff. They've worked so hard to get all of this done, and we have a new solution to help generate more revenue, easier, and impact the lives of the patients who really need what we do. And all things considered, we are good at what we do. Our numbers only go up, and this is an important measurement of patient results. Patients get results. It means our health professionals get results, and that means that we do too, and that's why our numbers look the way they do. We have the cookie and the bakery, which you should all well know by now. Now, I have the great privilege to introduce you to a very special doctor. He's board certified in cardiology, CEO of Elite Health, and he is a senior medical advisor for NutraMetrix. Please help me give a NutraMetrix style welcome to Dr. Stephen Schnur.
I'm going to answer three major questions which are kind of affecting healthcare and where we're going in the years to come. When you look at why is it necessary for medical care to include wellness options, it's because the landscape is changing. It used to be that physicians and hospitals were paid more when people got sick. So when I used to go to my friend who was the CEO of the hospital that I work at, he would say, look, Steve, I'm in the business of sickness. People get sick, We, the hospital, makes more money. As a physician, though, we're in the business of wellness. We're in the business of keeping people well. It used to be that as a physician, we would actually make more money by doing more diagnostic tests, more ancillary services. But the landscape has changed, thank God. And so now we actually do better by keeping people well. So it's very important for doctors and healthcare practitioners to know that wellness is an important part of the practice. And we recognized this years ago, and that's kind of why we picked NutraMetrix. And we've been very successful with NutraMetrix, and we're very happy with the NutraMetrix product line, and it keeps expanding. It just gives us so much ammunition of how to treat the patients. And the patients want one-stop shopping. They want to come to us and everything be handled at the office level. So when we look at where we've been as physicians and where we're going in 2014, things that are being launched because of Obamacare, which I'm sure everybody here is aware of, the Affordable Care Act, and what's called accountable care organizations. Physicians are joining what's called ACOs, or accountable care organizations. These are organizations which are going to pool their patients' data and then pay bonuses to doctors based on wellness. So the more well the population that a doctor takes care, the more, in essence, that doctor will make in bonuses. So the incentives have now switched where doctors will actually need to practice wellness and prevention. So NutraMetrix is really placed in the perfect situation right now, going forward in 2014. So there's no doubt that when you look at the future and we look at what is happening, it's in a state of flux, it's in a state of change. So NutraMetrix and Market America, which they do very well, has to change. You guys know that if you don't change in life, unfortunately, things don't go well. You have to be able to adapt and change. Because at the end of the day, it's the ones that change and the ones that keep thinking are the ones that are going to be successful. So in 2014 and forward, doctors are going to be looking for wellness. Doctors are going to get paid more for wellness. Therefore, the opportunity for everyone out here is tremendous to introduce, NutraMetrix to health professionals. And so they're going to be looking for these options. And so obviously going forward, we want to have a simple model. We want to have a model that's easy to implement for physicians. And we want to have a model that financially makes sense for physicians. They have to go in that direction. They're going to go in that direction. So NutraMetrix needs to go along with them. Thank you.
Thank you.
Okay.
Thank you, Dr. Schnurr.
All right.
Very good. Thank you. All right, so that's a fantastic way to understand from a health professional standpoint what really is happening in the healthcare community. There are so many changes and it's time for adaptation to happen. Now, how does everything we're doing tie into a new company and a new you? NutraMetrix, the whole team has worked so hard to process, automate everything so we can simplify and make this easy. And I will tell you, we have done it. Brand new people are duplicating and succeeding faster than ever. So I'm going to give you a quick top 10 rundown of what's changed in NutraMetrix so that you can see how simplified and automated this is getting to help ensure your success and your growth. Number 10, every one of you can leverage the power of NutraMetrix in your business by adding NC's NutraMetrix consultants to your business. Now, only consultants trained can set up health professionals. However, every one of you can invite NC's. But if you don't know everything about NutraMetrix, how do you do that? Well, all you have to do is invite them to a webinar because we show it for you every single Thursday night, and we stay on the line and answer your prospects' questions live so that you have those answers done every single week. Okay? How do you leverage? Every one of you right now can send an email to webinars@NutraMetrix.com. You will immediately get an autoresponder that gives you all the upcoming webinar links so that you can leverage this tool. Write down that address and use it. Anytime you have somebody that's a candidate for NutraMetrix, email it. The link comes back, invite them to a webinar. If you can invite, you can find consultants for your business. Next, number 9, we're leveraging the power of Meet On to bring you up-to-date content every minute of the day. It's unbelievable what's happening. Marketing Mondays, Takeaway Tuesdays, Wellness Wednesdays. The entire corporate team for NutraMetrix is pitching in to bring you the latest and greatest on Meet On. Go in and look under the NutraMetrix channel for all of that. In addition to that, we are bringing NutraMetrix to you through the NMTSS. Live NutraMetrix introductions, live NutraMetrix product training, and an implementation introduction. These will be launching very soon. Please talk to your local coordinator for date booking. Next, number 7, we've added regional NCs who are working now, and they give us a greater reach into the field to help bring you success where you are and help support success and growth even faster. Wonderful regional NCs. You can see their names up there. Next, number 6, we have launched Staff 123. Staff 1, it's a 3-part PowerPoint presentation. Staff 1 teaches the staff about wellness. Staff 2, it teaches them about NutraMetrix, and 3 is how to implement. Easy 1, 2, 3 process for simplified automation of implementation. Make it easy, live now on downloads. We've also added a whole new NC implementation workbook. Now, the workbook gives the NCs, our brand newest NCs, helps them help with a health professional account from hello to go now, all the way through step by step with scripts, forms, meeting agendas, and everything that you need to get a health professional from 0 to 60. Adding to that, we have our health professional implementation guide, also live now, ready to go. This has instructions for a brand new health professional from how to set up their account, how to log in, how to view reports, office staff forms, patient handouts, inventory management support, everything to really help the health professional get a successful and smooth implementation. It's there, live, download now. Now, one of the important things about these tools is that we pull from the field and from our own best practices to take what's working and systemize it and simplify it to help you get successful quickly. These tools are based on what works. Now, I have the privilege of bringing you someone who has demonstrated what works. He's been a top sales leader in NutraMetrix for years. He has a BS degree in nutrition, advanced orthogonal upper cervical care as a chiropractor, amazing, phenomenal business person, and, by the way, he is our very first NutraMetrix born director. Please help me give a NutraMetrix welcome to Dr. Stan Pierce.
For those of you who don't know me, I'm Dr. Stan Pierce, Jr. I have been practicing for about 15 years. Advanced orthogonal upper cervical specific care. It's a real unique specialty in the chiropractic profession. It involves digital X-ray analysis, 3-dimensional studying of the neck, a percussive instrument alignment, and it produces full body effects that tend to have a more longevity of results. So we tend to, with this nature, attract patients internationally. We have about 1,000 new patients per year from over 37 different countries that come into our clinic for this type of care. But because of the longevity of those results, we have to give patients healthcare homework to do in between their visits to enhance their recovery and optimize their wellness. So this is where NutraMetrix has become such an integral part of our practice. Because about 5.5 years ago, I got approached by an NC and saw actually Lauren came with her, and saw the potential of people actually being able to choose better healthcare solutions. Because no matter what doctor's doing in their practice, there is just always more you can do to help a patient. And so now being able to customize people's diets, supplements, and lifestyle choices to match their genetics, being able to help them, their body composition, their metabolism through TLS, being able to create custom formulas where you can get the nutrients absorbing at such a high rate. It's a fantastic approach for us, and we've seen our patient results go up dramatically. What else is fun for us is that we are the national training facility for this procedure, and so I get to share this with other doctors and say, look what we're doing. Look at our patient results. And those patient results just fuel the retail profits. And I guess the story on that is the last year, I'll say, that we used a different company's line, we had sold about $7,500 of their supplement line. And our first year with NutraMetrix, we sold $115,000, which is great. But 2 years ago, we sold $191,000. Last year, we sold $224,000. And this year, we're on track to breaking that, and it's just going to keep growing because these products work. They really genuinely work. And then when you take the orders and the BV and then you fuel that into the brilliant MPCP, you know, it's neat to hit the director pin. It's just, that's kind of a natural side effect of this whole system working. It's an honor, but it's kind of expected. And that's why you just keep moving forward and advancing your business through helping people. And I was trying to think if there was any one thing I could just share with you. I was talking to a few distributors, and I said, if there was one thing you would want to know, what would it be? And they're like, I just hate getting that no. I'm so afraid to talk to somebody. I don't want them to tell me no. And I was like, I'm going to tell you what to do about that. So here's the little pointer I would like to give you. People say time is your most valuable commodity. I don't agree. I believe health is your most valuable commodity, because if you have plenty of time but terrible health, a lot of people don't even want to live. So if our health is our most valuable commodity, and you believe that, and you know that's true for you, it's true for everybody you know. They may not realize it, they may backburner their health because of other family priorities, but it is their most valuable commodity. So if you believe that, and you believe in the products that we have, and you know how to simply explain those products to people, share your heart with them. If you are thinking about what can I do to help them have better health and better quality of life, and you're just pouring your heart out for them, they will be much more likely to say yes to you and give your product a chance. Fortunately, our products work, and they get results, so you're going to be backed up by good quality care. But if they say no to you, it's not them saying no to you. It's them saying no to a product or something they didn't understand. They're not saying no to your heart. They will never say no to your heart. So always pour into people what you can to change their health, optimize their recovery. If you work with NutraMetrix and work with doctors' offices, you can do that on a much bigger scale, and we can really impact this world in a great, great way. So thank you.
He's been very committed to the system, and he gives so much to the area and outside his organization. He's been a phenomenal partner to work with through these years. Now, as our countdown continues, we're down to number 4, plug-in success plan. Success works and the systems work if you plug in. So to help you with the Market America distributors with your NCs, we have an entire system in place to train them. After they go to NC training, they have Monday night corings. We have the prospecting introductions every single Thursday night. We have all the live tools and all the resources and these guides that we've shown you. It's happening, and it's gotten easy. We're seeing success faster. Also, we ran an accountability group. Accountability is huge. If you don't take action, you don't get results. You have to take action, and there has to be a decision somewhere in your mind that says, I'm just going to do it, and you're going to choose to succeed, or you're going to refuse to fail. Our Blast Off Accountability Group is great. We had 35 participants. These participants sold over $199,000. They earned over $115,000 in commissions, and they set up 52 new accounts. Now, our Blast Off Challenge winner is an NC feature that we have today. She sponsored 10 new partners during this period, and since World Conference, she has retailed over $37,000 in product sales, primarily using the Daily Essential Kits. And this is not through internet marketing. This is through hand-to-hand, event-driven sales. I am pleased to introduce you to our NC Spotlight, who is a former UBP coordinator, professional coordinator, TLS coach, regional NC, and certified NC. Please help me give a NutraMetrix welcome to Cheryl Wilson.
Give you a little bit of my background. I was actually a former school teacher, actually mathematics, calculus, which is everyone's favorite subject, I just know. And this company has made such a difference. After having life-changing results with OPC3 and seeing our amazing marketing plan, it was a no-brainer for me to partner with Market America and NutraMetrix. The Blast Off Challenge enabled me to actually take simple, duplicatable, consistent steps in order to reach momentum. And as all of you have noticed, how many of you have seen how NutraMetrix has just become such an incredible system now and all of the things? And a huge thank you to Lauren and the NutraMetrix team for doing all of that. It's made such a difference. So thanks to the Blast Off once again, we've been able to reach momentum. And you know, another important piece of this is personal retail. As consultants, it is still important that we are doing personal retail, building in the home, just as we need to do as a Market America business owner. So what we've been doing in the home, we have been doing our Wellness 101s. We have been marketing the Daily Essential Kit, as Lauren said. That is huge. It's the OPC, the B, the calcium in that multivitamin that can change people's lives. And when they ask you, how much is this? It's only about $1.50 a day to change your health. People cannot afford not to do this. So that is what has been enabled us to do so much that we've done, and a big shout out to the sales team and to Marty for pricing that the way they did. That has made a tremendous difference. You know, and people ask what drives me. So I'm going to tell you exactly what it is. How many of you are looking around right now, seeing people getting sicker and sicker, younger and younger people going on medications? That is what is driving me. I want to make a difference, and with NutraMetrix, we have the products and we have the system to change that. So you need to go out and find your passion, you need to follow the system, and you need to make a difference as well with NutraMetrix. Thank you.
She's done so well, and she's been such a great example to follow. She follows the system, and she is totally pushing the wheelbarrow. Now, one of the other things that we have, actually, that I get to show you, we actually have a new partner store. Thank you. We actually have, we're even, just talk about a new you, we're even changing how our health professionals dress. We have new scrubs partner. How about this? And you know what's cool with our new partner? These are completely soft and comfortable. How do you like 40% BV? Is that all right with you guys? But even better yet, for every set of scrubs that we sell, they donate one to a country that has health professionals who can't even afford scrubs to take care of their patients. Very big. Very excited about this. And by the way, there's a booth on the concourse that has those, and you can actually see, touch, and feel the quality. They're crazy soft, and everybody, the first word is like, wow, every single time. Now, as we roll down our countdown, we're down to number 2. We have completely worked on a new NC training for you, completely revised to be streamlined, simple, and automated. I'm telling you, NCs are stopping me in the elevator to say after day 1 of training that they already booked an appointment in the elevator on the way down and got invited to a health professional reception, because we teach them how to generate referrals and how to market and position themselves in business. It's working. By the way, we have 2 courses left this year, September and October. You can see the dates up there. Tickets are on sale at the booth. After what we have to say today, I don't think the tickets will last by the end of the day, and you'll understand why in a few minutes. Very, very big. Now, number 1, we have a new wellness goals poster. Check this out. Now, let's talk about this for a moment so you understand this. Wellness goals, it's about retail. I'll just tell you like it is. You don't take a multivitamin once and be done. It's like, oh, I took my multi 5 years ago, I'm good. No, we need it every day, but we need to help our health professionals get patients on a wellness maintenance program. So let's think about this. With 0, you know, what's your goal? If 0 is an absence of problems, how do you feel about your health? Well, maybe you feel like you're a -2 or 3. Okay, well, that's great, but where do you want to be? Well, maybe you want to be like a +2 or +3. Okay, well, the first step is 0. You got to get to 0. That has to do with detoxification, changing the food that you're eating. Maybe step 1, you're ready for basic essentials, the daily essentials kit and such like that. Maybe +2, you're ready for more optimal, understanding free radicals and antioxidants and such. Maybe +3, you really want what you need just for you. Customize your nutrition. Maybe step 4, you're ready to harness your metabolism and put the muscle back on and get your fit on. And maybe +5, you want to stop the clock and try to make things happen in the other way, because you realize after you finish growing up, you start growing down. Whatever your goal is, it's important to set a plan to get there. Well, what would you guys think if we had an education system that taught the patients how to do this while they're in the waiting room? How about that? All right, so now these brochures that are being written right now, they will educate the patients how to do this, and it's education-based, not sales. So we'll be able to, with NutraMetrix, put this on the wall, and the patients will learn how to change their health and get the results of these products in the waiting room. Think about the automation of this and how simple it is. Can you guys get the power of what this will do for us? We're very, very excited about this, and this will be coming out. You can see a quick snapshot of some of the insides. The poster is ready right now. The brochures will be ready shortly after convention. We're working on finalizing those. Now, you wrap this together, patient education system, and all the power and the systemization that we've set up for you. Add that to the HP1 program that we have. Now, for those of you guys who don't know, our HP1 program allows our health professionals to earn commissions from day one. They have minimized requirements. They do not have to sponsor to earn their commission checks. It's automatic. They move so much volume that they're able to earn commissions on their own checks and accounts that they refer to their NC. So we can help our health professionals grow, and they can earn up to $1,500 a week just in BV commissions with our introductory account option. This has made such a huge momentum and growth for NutraMetrix, and the whole power of this coming together, changing healthcare very, very quickly. Now, as we all well know, it's about the wellness maintenance program. We have our retail profit, which is the first step, but when we add in our BV commissions, we communicate total revenue to show what the system can do. How do you guys like the idea of 32,000 BV coming in your organization? The way you do that is you have consultants who help health professionals get patients on a wellness maintenance program. Think about this. If this doctor has 500 patients maintaining on an optimal formula for their wellness maintenance program, say people with a +3 goal, this is the kind of revenue that they can generate. Wellness maintenance, it's about residual orders, and people need to stay on a maintenance program. So that's the theme, but that theme benefits the sales for every single one of you. Now, for NCs, we implement. We consult, we find out what they need, we put together solutions for them to evaluate, and we teach, train, and implement, and you learn how to do this at the NC training. The booth has handouts for you and things that are available to help you with this, scripts and everything. And again, there's 2 NC trainings. We also have 2 health professional trainings simultaneous to those NC trainings in both Long Island, New York, and Tampa. Again, seating is limited. If you're here, you get first privileges this weekend to get it done here, and I highly suggest that you do. Now, I have one very special announcement for you guys. So you know the power of the HP1 that we've been talking about. And how many of you guys are familiar with it? That you know how big it is? Well, tell me, what do you guys think about this? Do you guys know what this means? All right, now you have to listen very carefully so I can explain this to you. This is a quick overview of the NutraMetrix Global Expansion Plan, which we will cover in the breakout tonight. Here's what we're doing. In the fall, we are adding account types of Health Professional and Health Professional 1 to all market countries. All right, now please note, it is not NutraMetrix system yet. What we'll be able to do is track and monitor health professionals. They will have access to the HP1 commission system and be able to work with that. We will monitor them for success and growth, and when there's enough activity to bring the full NutraMetrix program, we will bring it. And step 3, that's when we bring it. Okay, sorry about the hair. How do you get information about this? I'm just going to tell you straight out, you will not find information about this at the NutraMetrix booth. Okay? You can come to the breakout for it, but also you can send an email right now to hpglobal@marketamerica.com, and you will get an immediate autoresponder that gives you the FAQ. We will save your emails. We will update you in the future as it continues to roll out, and any updates will be updated to the FAQ, so that's where you can go to get all of that information. Very exciting stuff coming. Come to the NutraMetrix breakout later tonight for more information about this. Thank you all for having us, and we'll see you at the booth.